Let's talk to Chris Green, Conservative MP for Bolton North West. Chris, a very good morning to you. Happy New Year.
Good morning, Mike. Happy New Year.
Thanks very much indeed for joining us. Now, you're one of the guys who stood up in Parliament and actually voted down the very draconian rules that have been brought in with this new lockdown, so I salute you for that. Charles Walker made an incredibly impassioned speech. I'm sorry if you also did, because I only saw his one, but tell us why you didn't vote for them, and tell us what your fears are about it.
Well, the first thing is we have more quite draconian or quite extreme measures being imposed on so many people, so many millions of people in England. Again, this is the third time. And I think many people at home, even if they agree with the government doing that, they would still expect the government to have a vote on it, not just have it taken through on the nod. And the principal reason why I voted against it was because members of parliament should be informed. They should be informed by ministers, by the Department for Health, Education, all the other departments, to say, what is the impact overall of the COVID lockdown? We have a sense of the impact of COVID itself, but the government isn't being very clear with the impact of the lockdown. And if you look just at the cancer figures, it's reckoned that about 50,000 people who in normal times would know that they got cancer, would most likely be starting their treatment to deal with that cancer. 50,000 people don't know that they got that cancer. Will those people find out when the cancer's gone from a relatively early stage to late stage, perhaps even terminal?
Yeah. Well, this is our argument here.
Yeah,
this is our argument here at talkRADIO, Chris, because, while of course everybody's concerned about the numbers rising and the coronavirus deaths and all of that, we seem to be getting ourselves into a position where, you can't question whether there's something else we might be doing, because it's all very well to say, well, we must lock down because of all the people who are dying. Well, that's all very well, providing that will in some way be of help. But nothing that we've done so far in terms of lockdowns has necessarily stopped an awful lot of people dying.
No, and there's huge national support for the lockdown. Now, I think in part that's people want to deal with this situation, this crisis. But if people had more information, better information, saying this is the impact on heart disease, health, this is the number of people who haven't had that hip replacement operation or knee operation, or haven't had that cataract surgery. So we hear on the one hand, long COVID. We're not entirely sure what that means yet. There's a lot of work to be done to be clear on that. But we do know the impact on people if they don't have that hip replacement. No mobility, their standard of living is really reduced. We know in terms of cancer, heart disease, so many other things, that there's a huge cost there as well. In terms of education, so many children, so many primary school children went in for one day's education and they don't know when they're going to go back to school. Right. This has a massive impact. And the legislation goes till the 31st of March, even though the government's setting that kind of mid-February target for the vaccination program to roll out to set us free, so to speak. The legislation is the 31st of March. Surely we should be having another vote at the end of January, another vote at the end of February.
Well, clearly there needs to be some form of flexibility, doesn't there? Because, I mean, as I've been reporting for the last couple of days, my teenage son yesterday said to his mother, what are we supposed to do until March? They can't see their friends, as far as their understanding is. They're not allowed to go anywhere. They can't really go walking in the park with other people in case the police suddenly come up and tell them they shouldn't be doing it. I mean, I've got reports this morning of children and parents being stopped by police out sledging in somewhere in Worcestershire. There seems to be a lot of confusion about what people can do and what powers the police have over what they're doing.
And we know that people being cooped up indoors with other members of the family, with other people, it's worse for transmission if you're indoors rather than out and about, having a little bit of exercise. Having a healthy lifestyle is one of those factors that actually makes you more resistant to COVID and more resistant to other diseases, and actually maintains your mental health as well.
Yeah.
But my concern now is when we're looking forward, after a fashion, we're looking forward to the first anniversary of COVID lockdowns. Last March is when it's happened. The government introduced the legislation for a 6-month period. That was renewed in September.
Yeah.
Now in March, we're going to be looking forward to another 6-month renewal of these powers. And I think the government should be coming forward with, okay, they say the vaccination's the way out. 13 million of the most vulnerable will be protected by mid-February. Okay, take a couple of weeks for it to kick in. So at the beginning of March, 13 million of the most vulnerable people will be protected.
Right.
Do we really need another renewal at the end of March of this legislation? The government should be coming forward saying we no longer need it, and perhaps for a month, but no more than one month at the end of March. And this is the narrative I think that the government needs to be building up, of a return to normality, a return to our civil liberties, not a new normal. It's the normal we choose for ourselves.
Yes, I think you're absolutely right. And such an intelligent way to approach it as well, because, you know, we were told towards the end of last summer and into sort of the autumn that once we had the vaccines, that would change everything. And it hasn't changed everything, has it? I mean, and let's not get into whether or not they've been as efficient as they could have been at rolling out the vaccine, which would appear not to be the case. But, you know, certainly we were led to believe that as soon as the vaccine started to kick in, that would mean that we could return to a more kind of, you know, safe place in terms of opening gyms up, in terms of people going back to work, kids going back to school, you know, because we can't just keep doing this forever, can we?
No, and I was quite concerned with Chris Whitty the other day saying we'll have certain measures perhaps next winter. And that lends itself to that concern of just when will it come to an end? If they're already, in a sense, setting up the narrative. So if we extend these COVID lockdown measures another 6 months, well, that'll take us to September. That'll take us to the normal respiratory season.
Yeah.
And we're pretty much going to guarantee it'll be for another 6 months at that stage. And this is where members of parliament, members of the public, sharing their concerns with members of parliament need to come into play. And ministers need to be articulating, this is our exit. This is the stepping stones we're going to be taking to a full exit from these lockdown measures. Because if we had been told a year ago, nearly a year ago, that it won't just take a year, it's going to take 18 months plus some more, I don't think we would have gone down this route in the first place.
No, I think you're absolutely right. But I can guarantee you one thing, Chris. Next winter, we will be in crisis once again in the NHS, whether or not the coronavirus is here or not, because we're always in a crisis in the winter in the NHS. And now we're told that we can't say that because in some way that might be misleading. But let me just say this to you as well. We had a call earlier on the show from a poor guy down in Plymouth who wants to go and see his mother in a care home, was able to see her a week and a half ago, was told today he can't see her, was not given any reason why, but presumably the lockdown is the reason, not given any indication of when he might be able to see her again. And when he went to see her last time, they were behind screens. He said it was like seeing somebody in prison. I don't understand why people have to change those rules if they're already COVID secure.
Well, this is one of the extraordinary things that we think we have the technology, we think we have the ability to say, if you've had a test or perhaps you need a couple of tests before going to visit someone, you're safe, you can go and visit, you can have that normal human contact. And yet these basics, these essentials still aren't being done. And this, I think, is a huge concern. Why aren't those normal aspects of society being returned to us? And whether it's problems with any kind of big plan, anything to do with bureaucracy and civil service, and the interpretation of those rules is very difficult. But this, again, should be a reason why we ought to be incredibly cautious about having these rules in the first place and renewing them in March.
I think you're absolutely right. And as far as the 16 of you, I mean, do you imagine that could change in terms of a number? Because obviously, you know, it was a bit bigger than that before. I can understand why some MPs might have said, well, because of the bigger numbers now, we're not going to vote against the government this time. But I mean, what's your sense of the general feeling in Parliament?
Oh, I think the points you made are it. There's, in a sense, a way out. We've got the vaccination. We can see it's no longer a cave. We're trapped in it. We can see the light at the end of the tunnel. We've got that plan. There's this new strain of COVID, which is more fearsome than the last version. So I can understand why colleagues were cautious about opposing the government plan now. And this is why I think this next vote in March is going to be key. If the government plan isn't seen to work, do we then have to look at another track, another option? So I never thought this current vote would have been very difficult for the government at all. But it's all about, I think, maintaining the debate, maintaining the conversation, giving a bit more understanding to people. And then members of Parliament who voted for this plan, in this vote, and this is one of the key things of having this vote, they voted for a plan which will see the delivery of vaccinations, see us getting towards the spring, getting towards the summer, and we know these problems go down towards the end of the respiratory illness season. So they've voted for a plan that will see the end of COVID and the crisis as we know it at the moment. More treatments are coming down the line. And therefore, if they're asked to vote for more measures in March, they have to ask themselves, I've voted so many times over the last year for plan after plan, lockdown after lockdown. When does it come to an end?
Yeah.
They've got to ask themselves that question.
I think that's absolutely right. Chris, great to talk to you. Thank you very much indeed. Chris Green, Conservative MP for Bolton North West, one of the good guys who's actually asking questions, as indeed are we, right here at Talk Radio.